a lot of the treatments that I watched her do here, she's done before, but doing them here all together in the way that you did them together is what I think what really made the difference. Could you speak to that? And because there are so many good clinics out there that maybe do the right things, but they don't really have the right recipe put together.
Yeah, so I'll try to summarize it in a couple of main components. So we definitely have this cycle that we use for treatment across all of our patients. And it might sound very simplistic. It's prepare, activate, rest. But within that, there is a ton of science backing as to why we chose that. Let's take the prepare stage, which is exercise. A lot of people exercise, but there are different types of exercise, and exercise can influence the brain directly and allow us to prime it in order to engage plasticity. We actually use different physical techniques in order to increase neurotrophic factors, basically the on signal for plasticity. The next thing we do is that when patients are going through this multimodal treatment, we're going for an integrative approach. I mean, let's take, working on that one muscle, on that one bicep. Well, one bicep does not an athlete make. When we're looking to rehabilitate an entire brain, it takes, conjunction. It takes therapists talking to other therapists. It takes an approach which, for example, we can use different visual exercises, which are visual systems back here, to work on prefrontal areas of the brain. The brain is at its core a network. It is a system. So our expertise, the therapist expertise, and all of them standing on top of that F&CI to do what they do allows us to get the outcomes that we do. On the science side as well, I mean, for example, a year ago or a little bit more, we didn't fully appreciate the influence of something called the autonomic nervous system for all of our patients. The autonomic nervous system, in brief, controls our fight or flight and our rest and digest balance. It's all of our automatic processes that go on in our body. A significant number of patients have dysautonomia. If we're talking about how successful we're going to be, the autonomic nervous system controls blood flow in the body. If the autonomic nervous system is affected in a patient, it's going to affect their outcomes. We implemented an autonomic nervous system protocol, and we've trained some of our therapists to work with it. Outcomes have gone through the roof. So that's how that science feeds back into what we do, all with that purpose of getting patients better.
And the last part of that, because she discussed prepare and activate, the last part was rest and destimulation, because there is an art and a science to resting that brain and knowing when that brain needs to take a break. Sometimes we can do it with some biofeedback. There might be some meditation, some mindfulness. It may also be some exercise in a way. We however that body needs to destimulate, we can build that in. But that's a necessary component of that PAR, prepare, activate, rest.
It's the same thing as sleep. I mean, we consolidate memories when we sleep. We are trying to simulate a learning process. And that's how we can do it in sometimes 5 days.
The PAR, in and of itself, is not the key. It's combining that with the imaging and knowing exactly which areas need it, in which direction, right? Either hyper or hypo. So my fear is that people will say, oh, well, okay, all I got to do is prepare, activate, rest, prepare, activate, rest. It's like, that's not that simple either, because you need to know where to apply that and when.